A few suggestions to help reduce your monthly health insurance premiums. Hello, I am Kevin Knaus, an independent health insurance agent in California and also a certified Covered California agent. And as we all know, for 2026, the premium rates are up and the subsidies have gone down. So a lot of people are looking at ways to try and reduce their monthly health insurance premiums without sacrificing, health care. So here are a few suggestions that you might consider. One would be changing your metal tier plan. Going from platinum to gold, gold to silver, or silver to bronze. And the rates will be less and you will save some money. Because whenever you go down in the metal tier, your cost sharing, your burden of healthcare expenses goes up. That's just the way the plans are designed. So you'll be paying more for your healthcare services. However, people in a silver plan should look at the bronze. There has a lot of benefits. So on the bronze 60 plan, the primary care office visits are $60. Under the silver 70, it's $50. So not a huge savings there, depending on how often you go see a doctor. Lab tests are both $50. Generic drugs are $20 and $19. Where the bronze can bite people is that there are several healthcare services that are subject to the medical deductible of $5,800. So you need to spend $5,800 before you go into co-insurance, like for an emergency room visit, an x-ray, imaging, surgery. With the silver plan, there is a medical deductible, but it only applies if you are an inpatient in the hospital or in a skilled nursing facility. Otherwise, some services like outpatient surgery would be subject to 30% co-insurance. And then something else to note is that the maximum out of pocket of the bronze and the silver is exactly the same. $9,800. So if that big illness or unexpected accident occurs and you're hospitalized, you're going to hit the maximum out of pocket with the silver or the bronze. You just know it's going to happen. But if you have the bronze and you continue to make your premium payments, they will be lower. Once you hit your maximum out of pocket, all your healthcare services and prescription medications are covered by the health plan. So for some people that don't utilize healthcare services a lot, the bronze plan may work very well for them. Those people who have expensive brand name medications, the silver plan definitely has an edge because you get a break on those prescription drugs under the silver 70. Looking at one particular example here after a subsidy, Kaiser Bronze is $247 for this individual. The silver plan is $505. That's a savings of $258 per month, $3,000 annually. So that's some serious cash, and of course that savings could go towards meeting any medical deductible if you had to move through it. Now, there is kind of a contradiction to the metal tier logic. Go down in metal tier, costs go up. That isn't always the case. And that's something only you can kind of pencil out. But there are times when actually going up in a metal tier will save you overall on your healthcare expenses, because the gold and the platinum have no medical or pharmacy deductible, and lower co-payments for many routine services, lower co-insurance, and lower maximum out-of-pockets. So if you can kind of forecast your healthcare services in the next year, maybe you've got a surgery coming up, you might be able to save some money by actually going up in a metal tier if you do not believe you will ever hit your maximum out-of-pocket. On this particular example, we have that Kaiser Silver plan at $505. The Kaiser co-insurance gold plan is only $544 for this particular individual. So the gold plan is only $39 more per month, $467 annually, but the gold plan has a lower maximum out of pocket by $600. It's $9,200. So right there, you're to the good. Of course, no medical or pharmacy deductible, and generally lower co-insurance. So that's kind of an odd one, but sometimes you need to look at all of the options on the metal tiers because sometimes you can save some money by actually going up. Another way to save money is the plan type. We know that HMOs are generally less expensive than EPOs and PPOs in most instances. So as you go up in the plan type, the premiums go up. So maybe if you're in a PPO or an EPO, drop down, PPO to EPO or EPO to HMO. Now, with an HMO, have to have a primary care physician who is the gatekeeper, makes all the referrals, orders all the tests. EPO has no out-of-network coverage, just like the HMO has no out-of-network coverage. But you can go see any doctor you want in the network, just like a PPO. PPO, go see any doctor in the network, no referrals, and there may be some coverage for out-of-network services, but the out-of-network deductibles are so high, you just want to try and stay in network. The PPOs can have a larger network of providers, and that's what a lot of people will lean on. But let's looking at this particular example, the Blue Shield Silver 70 HMO and the Blue Shield Silver 70 PPO, exact same plan. Okay, all exact same cost sharing for you, maximum out of pocket. The HMO is $331 per month lower than the PPO plan. Of course, the network is different. And if you need certain doctors, then you can't get with an HMO plan. You may be kind of stuck with the PPO plan, but you can save money in general by going to an EPO or HMO plan. On this particular example, comparing the Blue Cross EPO to the Blue Shield PPO, the Silver 70 Blue Cross is $615 per month, and the Blue Shield Silver 70 PPO is $778. The EPO is $163 less per month. Exact same plan, exact same cost sharing, maximum out of pocket, everything. And in this particular case, the provider network is kind of similar. The Blue Shield PPO definitely has more doctors and hospitals and medical groups in it, but that's where you need to check to see who is in network. And many times searching for clients, I find that many of their doctors are in that Anthem Blue Cross EPO. Sometimes you have to give up a doctor. Is it worth it to save $163 a month? Maybe you only see that doctor once a year. Maybe you forego that one particular visit or find another doctor. Another way to save money, and this is really interesting because a lot of people don't really think about it, but you can split up family members, and it's very easy to do in Covered California. In fact, that is a real perk of Covered California, to be able to split up family members, and even for people who are never going to get a subsidy, just the management of putting people in the different plans as opposed to filling out a different application for each individual with each different carrier. This is very, very nice. To do this through Covered California, you go to your homepage, then enrollment dashboard, and right there in the middle, it'll say Manage Groups. You want to click on Manage Groups and you'll be brought to this page. And when you do an application for Covered California, all the household members are put into one group. So in this particular example, we see parent 1, parent 2, then their children, dependent 1, dependent 2, all in group 1. Scroll down a little bit on that page and you will see Add a Group. You want to click on that, and then you can drag different household members into group 2. You can add many groups, 3 and 4 groups. Each person can have their own Medaltair plan and completely separate carrier. So what it looks like when you're done for this particular family, parent 1 is in group 1, and in group 2 we have parent 2 and the 2 dependents. And then when you go to the enrollment dashboard, back to that, you'll see that parent 1 can enroll in their own plan with their own subsidy, because it is important to remember that the subsidies, if you're eligible, are by individual, and they are tied to the individual if they move into another group and to another carrier. So if someone's eligible for $100 a month and they're in their own group, they'll still get $100 a month. Group 2, you can see parent and 2 dependents there. So what does that look like in reality? In this particular family, 4 household members, parent and the 3 children, are in a Bronze Kaiser 60 HMO plan, $444 per month. The other parent has a serious medical condition and needs certain specialists only at a particular medical group. So they put that parent in their own group, and they are in a Bronze high deductible health plan at $341. Now, had all 5 people been in that Bronze high deductible health plan, they would have been looking at least $1,500, $1,800 per month in the health insurance premiums, just because the Blue Shield PPO is so expensive and has medical groups like UC Davis and UCSF in it. So that's one way to save money. Now, of course, you're going to have separate bills. You kind of lose to a certain extent that family deductible, family maximum out of pocket benefit, but there are trade-offs for saving hundreds and hundreds of dollars every month. And doing it through Covered California, again, even if you're not getting subsidy, it is nice and clean, and you can go in and manage all of that. You can change addresses and phone numbers, and then that gets distributed to all of the different carriers. You don't have to worry about calling each one individually. Oh, my email changed. Can you update this? And so it's all done through Covered California. It's very, very nice. So those are a few suggestions on potential ways you might be able to save on your health insurance premiums for 2026. If you have any questions or comments, feel free to leave those down below, and I'll do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.